This is your TCCC card. This is your casualty documentation card. All right. It comes with an amazing diagram. It's simplified because not everyone knows how to document. Being a lay responder, being a bystander, things of that nature, you want to make sure that documentation is somewhat standardized across the board, because how much time did it take for you to get to your patient? How much time did it take for you to treat your patient? How much time did we have to wait for an evacuation vehicle to get the patient? Along the lines of that patient care, there's going to be a lot of hands on that patient. So having proper documentation, accurate documentation with that patient is going to make it so much easier for the continuum of care. All right. So with this diagram, you can go ahead and actually draw what's wrong with the patient. So if they're missing an arm, go ahead and squiggle that out. If they have a tourniquet, go ahead and draw that tourniquet, or a T for that tourniquet. It also breaks down the rule of nines for burn casualties as well. And we'll go in depth into later videos about the rules of nine and how to treat burn casualties. So it also has the patient identifiers, mechanism of injury, injury sustained, and signs and symptoms. It's front to back as well with the treatments rendered. So if you actually think about that, patient identifier, mechanism of injury, injury sustained, signs and symptoms, and treatment rendered, that's going to be your MISH report. All right. That's going to be a quick 30-second report that you could use to hand off this patient to the next person, the next medical professional, so that we could save time and have an accurate accounting of that patient, hopefully, right? I'm not saying that everything's going to be perfect the first time you treat a patient. Things can go wrong, so you have to be able to adapt and overcome. And that's why documentation is always evolving with that patient, because going back to a tension pneumothorax, that takes about 15 to 20 minutes for it to actually build up pressure in your thoracic cavity for you to show signs and symptoms. So you're not going to necessarily find that from your initial treatment, from your initial patient assessment. It may take a little bit of time. It may take the next person to find it. So being able to identify it and document it, going on and on and on to the next person, is going to give that overall picture for when that patient gets to the emergency department.